So what is an ACL tear? Well, the first thing that you need to know is what is the ACL? The anterior cruciate ligament, it runs through the inside of the knee at a slight angle. And what it does is it keeps your shin bone from sliding forward on your femur or your thigh bone here. Now, most of the time, ACL injuries happen non-contact. It's where the knee buckles and drives to the inside, that shin bone slips forward, and the ACL tears. Now, what you want to be able to do is, one, you can go see an athletic trainer, a physical therapist, an orthopedic. They can do different special tests to figure out if that ACL is actually torn. Some people have pain with it right away and are unable to walk on it. Others can start walking, even doing a little bit of exercise, but the knee typically feels loose, like it wants to slip. So when it's checked out, there's a few special tests you can do. You can also get an MRI, which confirms it ultimately. Then from there, most people elect for surgery. However, that's not always needed. We've rehabilitated some professional athletes who have gone and competed without an ACL. So you don't always have to do it. It really depends on what's right for you. I certainly recommend getting physical therapy, especially from a cash-based practice versus your typical insurance-based. You're going to get a lot more specifics for the sports movements that you need if you're an active person. So if you are deciding to get that surgery, it's always recommended 30 to 60 days of prehab or physical therapy, which is going to help you tremendously once you get out of having the surgery. Now, if you've already had surgery with your ACL, one of the biggest things that we want to do right away is control the inflammation and the swelling in the knee and gain range of motion. So there are a number of exercises that we can do. Oftentimes your orthopedic or your surgeon will give you exercises that they would like you to do, but being seen by a licensed physical therapist or athletic trainer is a great way to start rehabilitating and allowing the injured area to heal that much faster. If you're located here in the Orlando area and you believe that you have an ACL tear and you'd like us to take a look at it, we would be happy to take a look, figure out whether you need further imaging or if there's something else going on in the knee, and we can rehabilitate it without any surgery or additional services needed. And then if you are having ACL surgery or you've already had it and you want something a bit more advanced than the physical therapy that you are given from your doctor making a recommendation or just your typical insurance-based physical therapy, we'd be happy to dive into that and give you a hand.